Compare and contrast the development of type 1, type 2 diabetes. Diabetes, they are caused by the completely lost function of pancreas beta cell. The pancreas beta cell is a cell that secretes insulin. And insulin is a hormone induce the glucose transfer inside the cell from the blood vessels, so it is capable of reduce the glucose level in the blood. Type 1 diabetes is caused by autoimmune system. That means the immune system will target the pancreas beta cell and kill them. The loss of completely destroy of all the beta cell in type 1 diabetes patient will cause the emerge of diabetes. The patient of type 1 diabetes requires continued injection of insulin and regular exercise. Because obesity, there is some findings that obesity and no regular exercise have higher relation with diabetes. Type 2 diabetes is different. Not all the type 2 diabetes patients requires continued injection of insulin because type 2 diabetes patients usually have beta cell, fully functional beta cell, and the insulin level may higher than ordinary person because the cause of type 2 diabetes is the lost sensitivity of insulin receptor. That means the less sensitive of the receptor means requires higher level of insulin to trigger the cascade, taking the glucose from the blood vessel. So the patient requires higher level of insulin to trigger the system and bring such a labor for the beta cell. And because of labor, the beta cell will gradually dead because of continued secrete of insulin. There is a theory. Here the endoplasmic reticulum stress. In normal cells, the continued expression of a protein in a cell will cause endoplasmic reticulum stress. That means a lot of proteins are compact in the endoplasmic reticulum will cause improper folding of the protein. And the improper folding of protein may bring some disadvantage for the species. So during the evolutionary history, the cell have some kind of mechanism that prevent that happens. So the continued expression of the gene in the endoplasmic reticulum will lead to apoptosis. The same as type 2 diabetes, the insensitivity of the insulin receptor cause Uh, the beta requires beta cell to secrete more higher concentration of insulin cause continuous secretion of insulin. And when they take in food, they require more insulin to put this glucose uh, inside the cell. So because of this stress, uh, the beta cell continue gradually dead because of the apoptosis, because of the endoplasmic reticulum uh, stress. The type 2 diabetes also, the cause of type 2 diabetes also related to some gene mutations. The mutations on the receptors, on the mutations of the tyrosine kinase, there are over 80%, 90% of patients, diabetes patients are type 2 diabetes, and that affect 18% of the 65 years old population. Uh, and some people even don't know when they gradually get the type 2 diabetes. When they still don't know, the research shows obesity and lack of practice, exercise have a strong correlation with diabetes. So to avoid type 2 diabetes, uh, we should do exercise regularly and reduce the body weight. So thanks for watching.